get back to your world again, right? When we've got the conventional process that we know and love, right? This in my world, it very rarely worked out for 5 appointments because, like I said, the bites are difficult and the try-ins are difficult. And so what we want to try to do is maybe eliminate a couple of these by looking at a different way to take our impressions and bites first, and then a different way to do our try-ins. My goal would be to eliminate bite rims if we could, because I've seen what a challenge they are. But in the right hands, and if you're comfortable with them, you certainly can still use those. But what I'm going to talk about today is what I call the reference denture digital workflow. So, and that turns into a 3-appointment digital denture. Now, there's multiple ways to do a 3-appointment digital denture. As a matter of fact, Rowe has created one of what I think is one of the most genius ways to do it. We're going to show you that in a second. But think about it, right? When I said 5 appointments to do a denture traditionally, and most of us know that typically takes 6, 7, or 8, we're going to show you a way to do it in 3, and that makes it maybe fun again, right? So what is a reference denture? A reference denture is just a denture the patient already has. Right? Demographics tell us that 80% of denture patients have a denture already. Now, when they come to your office, they may not bring that denture because they don't like it. Right. And we know this too from statistics that more than half of denture patients out there are not happy with their denture. It's amazing we keep doing as many as we do, but it's just not a great science. And I don't want to offend anybody at all, because I know that we've all done great dentures, right? Or otherwise we wouldn't keep doing them. But so many patients say, I don't like it because of this or this or this. And what we see is patients coming into the office for a new set and not bringing the old set because they're scared we're going to make them another set just like that. And they don't want that. So we ask them, right? Do you have a denture? Yes. Well, I want you to bring that denture in because we're going to use it as our foundation or our starting point to make you an even better set of denture. Right. So what this does for you in the operatory is it gives you a better tool to take that preliminary impression and bite with. Right. If the teeth are worn and we're going to open the bite, then do so. Right. Put a little piece of wax or putty or composite in the back, open the bite to the proper vertical that you want to, and then take your bite registration to that opening. Right. And then we're going to take an impression in those dentures. Much easier for you to get a bite registration and an impression using this method, right? We don't worry about custom trays. We don't really worry about compound around trays and border molding that way. What we're going to do is we're going to use a heavy or medium bodied around the rim of the denture first to do our first step border molding, right? And then we're going to do a wash on top of that and do the border molding movements again. I'm a big fan of functional impression border movements. We use this with the Hydrocast tissue conditioner we used to use, but I credit Eric Kikucha, who's a denturist in Canada, to really bring this method back up to the forefront. And he basically says when we would want to do border moldings with an impression around the rim of a denture, we put it in the patient's mouth, hold it in with finger pressure, and then tell the patient, go ooh-ee, right? And stick the tongue out left and right on the tongue, and then close the mouth and swallow a couple of times. And that will capture all of those border muscle movements that we need, right? Do the same thing with the wash impression, right? Again, and boom, we've captured our impression, we've captured our border molding movements, and we're ready to move forward. So how do we move forward? Well, simple answer is you could send those dentures with the impression wash and the bite registration to the lab, and they could put it in their lab scanner and digitize it for you, return the dentures back cleaned up for the patient. Now, we all know that most patients aren't going to allow that, right? They don't want to be without their teeth. It's one of the key things with denture patients. They're so terrified they're going to break or lose their dentures. So you may have to duplicate those dentures, right? So take your old Lang denture duplicator with some Algin and make a duplicate set and use that for your impression and bite. What I want to propose today is that third option, which I think is incredible for those of you that have an intraoral scanner. If you don't, I'm sure you're thinking about it. We're going to use that intraoral scanner to scan that reference denture impression and bite. Right? It's a pretty simple process. Kudos to Dr. Wagner on this case. This is a lower denture that the heels were worn, so he built it up with some compound. Again, the heavy bodied around the border, goes in the mouth, capture those border movements, go back with the wash, go back in the mouth, capture the movements again, then take a bite registration between the dentures. And this denture was a little worn, just ugly and broken down. Patient was ready for a new set, but overall happy with the occlusal plane, which is a great source of information for us, right? So it's easy to get the bite, patient's more comfortable. And so that's the reference denture workflow. We take it out of the mouth then and we start scanning. right? And you see that in this case, I've sprayed some powder on the impression wash. That really is dependent upon the scanner and the impression material you're using, right? And in this case, this was the Improgam, and it's kind of reflective, so I thought a powder might help. Don't always have to do that, but the scanning of a reference denture impression is so much easier than trying to scan that edentulous ridge in the mouth, right? You hold the denture in the mouth and you go through the ridge area. You zigzag across the palate. You go back and you roll over the border. Then you roll down and scan the buccal, right? So what we're scanning here is an impression, not a denture. So that means I don't need the occlusion and I don't need the tongue side of the denture. I just need the intaglio, the borders, and the buccal so that I can line my bite up, right? So I do this on the upper, do this on the lower, hold the two dentures together with the bite material and scan the left side and right side for my bite registration, right? Rowe has a great video on their YouTube channel showing you how to do this, but you literally can do this scan in 2 to 4 minutes of denture. And so it's fast, it's easy. The scanners are pretty accurate at it. And it's a wonderful thing to do. It really is. It's so much easier. And it is exact records that the lab needs to start their fabrication. So this is Dr. LaRusso scan path again, and I showed this because this is what I use when I'm scanning a wash impression and a denture, just following his same scan path, just to keep me organized, right? That's the enemy of scanning is over scanning. So you don't want to overscan. So follow a specified path, get in the habit, do the same thing over and over again. And again, with the reference denture, I'm not scanning the occlusion or palate, which would create more data that I don't need and take longer time. So just don't do it. Notice the picture in the middle and the bottom. I've not scanned the palate side or the tongue side of the denture at all. So what you end up with, right, is a couple of digital models. And what you see here is the purple is the reference denture, and then the white is the teeth that we've picked. So this really helps the lab, right? So if the patient says, I like the way these fit for the most part, I wish they stayed in better. I like the way they occlude when I chew. I like to show a little more length. All that's great information to give the lab, right? And we can use that reference denture as a guide. The biggest win on a reference denture impression when we set up dentures digitally is we're going to put the tooth or the teeth set up in pretty much the same occlusal plane as the existing dentures, right? The goal here is that when we make our final denture, our tri-end denture, we want to go in the mouth and the patient not feel a whole lot of difference. You know, maybe we're opening the bite a little bit, but if the patient says they love what they have occlusally, then we're just going to set the next set of dentures exactly like that. This is going to shorten our number of tri-end appointments greatly. It's going to give the patient a much more comfortable appointment with the tri-end when we go there. So that's what we use with the reference denture impression. Now, I'm going to show you the way I've been teaching it, right? So from that denture design, we're going to print out a monolithic version of that denture design, right? This is a Vita shaded, what we call a test drive or take-home denture. Right. Full strength. The patient can wear it for 30 minutes or 30 days if they want to, but it gives you, the dentist, the ability to put something in the mouth that was designed from a reference denture. So the occlusion should be pretty close, but if it's not, you just grind on it. If you want to add to the length or if you want to draw on it, you know, anything you need to do to communicate any changes needed back to the laboratory. You can use your intraoral scanner to scan it after those changes. Or you can send it back to the lab and they can scan it. They will merge it over their original design and create the final from those changes, right? I like having this to send the patient home to wear it overnight, have dinner with it, you know, get a little comfort, let it settle in a little bit. And, you know, my thinking was this will also become a replacement for custom trays and bite rims, right? We'll have a printed set of tri-ends that we can modify a little bit. If the bite's not right, we take a new bite registration. If the intaglio is not right, we take a new wash impression, right? That can be scanned and move on to the final from there. And that literally would be a 3-appointment denture, right? We start with monolithic. And we're seeing great success with this, by the way, guys. These monolithic tri-ends, when they're designed from a reference denture, right? They're a lot closer with that tri-end appointment, and there's very few modifications needed. So 3 appointments are working pretty good.